Morning, good afternoon, and good evening. Welcome to the 1390th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you. Today we have with us Dr. HUANG WEI LING. Dr. Ling, born in Taiwan, raised and graduated medicine in Brazil, specialist in infectious and parasitic diseases. A general practitioner, parenteral and enteral medical nutrition therapist, acupuncture, pain management, and homeopathy since 1997. She works with the approach and treatment of all chronic diseases in a holistic way. The treatment guided through the teachings of traditional Chinese medicine and Hippocrates. Author of the theory of constitutional homeopathy, the 5 elements based on traditional Chinese medicine. Author of more than 230 publications about treatment of variety of diseases, rebalancing the internal energy. The topic is post-COVID scenario and homeopathy. And welcome Dr. HUANG WEI LING. You can have the platform for the next 45 minutes. It's over to you. Please proceed.
Hi, thank you very much for introducing me. Thank you for inviting me today to share my studies about the post-scenario COVID. I want to share my screen.
Yes, you can. Yes, start it. Good.
Oh, let me see.
Yes. Okay.
Okay.
Yeah.
Here in Brazil, it's morning. Good morning to everyone. Good afternoon or good evening. My name is HUANG WEI LING. I'm a medical doctor from Brazil. It's my pleasure to be here today to share this study titled Post-COVID Scenario and Homeopathy. I would like to congratulate all the IFPH members and all the Hahnemann's anniversary yesterday for congratulate all the group for this anniversary. This study that I will share will be following Hippocrates' thought that said that foolish the doctor who despises the knowledge acquired by the ancient. Hippocrates said that it's more important to consider other ancient medical traditions prior to the knowledge we have nowadays. So in this presentation, I will share the reasoning used by Ayurvedic and the traditional Chinese medicine that exists for more than 5,000 years to explain this post-COVID scenario and homeopathy. All this reasoning that I will use today began in 2006 when I treated one specific patient that was presenting pain in the legs, and he was not improving, only using anti-inflammatory medication. He went to my clinic and instead of treating his symptom, I treated his energy alterations. He was having kidney and energy deficiency, and treating this energy deficiency, it was possible to treat his leg pain, but also he said that he had been treating for glaucoma for the last 40 years with no improvement of his condition, only using eye drops. And for the first time of his life, his intraocular pressure reduced from 40 to 17 mmHg. And that's why I'm saying that it's important to treat the energy alterations instead of treating only the symptoms. In this tree metaphor, I usually use in all my presentation, in all my articles, to show the different viewpoints between Western and the traditional Chinese medicine. And I think homeopathy is also following Western medicine diagnosis because they are looking at the symptoms. This tree is composed by the two parts, the part above the earth and the part under the earth. The part above the earth is what we can see by the naked eye, composed by the many branches. Each branch means one medical specialty. In this case, COVID-19 is a leaf level of infectious disease branch. Is only a symptom. And all the symptom is presented at the leaf of this tree, such as in orthopedic, you can see pain in the legs, low back pain, knee pain, etc. And in this ophthalmology branch, you can see many kinds of disease, such as glaucoma and other disease. And traditional Chinese medicine understand that all kinds of disease, the cause is not on the leaf level, the cause is on the root level of this tree that we cannot see by the naked eye. And this is what I want to describe. The energy alterations in the whole population in this world is suffering that leads to COVID-19 infection. And also TCM also considers the influence of the external pathogenic factors, such as the influence of cold wind, heat, humidity, and dryness. And in the root of this tree, there are two theories that are yin and yang and the 5-element theory that you can see. Yin and yang is symbolized by this figure. This is yang, this is yin. They need to be in a balanced state. And in our treatments, we aim to balance this yin and yang energy. In the case of patients with COVID-19, for example, I did research in my clinic in Brazil, analyzing the energy of all these organs, internal 5 massive organs, before the COVID-19 pandemic from 2015 to 2020, before the pandemic. And these results was that 90% of all my patients in Brazil were in the lowest level of energy in the liver, in the kidney, in the heart, in the lung, and the spleen, meaning that the energy production by these organs were compromised, meaning that the majority of patients that were suffering from COVID-19 were considered immunocompromised due to this energy deficiency situation and not due were very weak in energy. And that's why I created another theory in 2015 when I began my homeopathy course, when we can treat this condition of tonifying the energy of the liver, kidney, heart, lung, spleen using homeopathy medication. And this publication was published in 2021, titled Energy Alterations and Chakras Energy Deficiency and Propensity to SARS-CoV-2 Infection. When your energy is low, the majority of patients nowadays are in this situation, meaning that the majority of patients, including in India's patients, this is happening globally because this is caused by the influence of the electromagnetic radiation caused by the modernization of telecommunication after the implementation of cell phones and computers, mainly after the implementation of 5G technology. That is why the energy that each organ produces, such as this is the schematic relationship between the 4 energies in the root of this tree that is very important to us to understand, to know why the patients were dying of many treatments, including the COVID-19. Yin and yang is produced by the kidney, blood by the spleen, qi is produced by the lung and liver. They need to be in this relationship. And as I told to you, the internal 5 massive organs were not working, were not having energy, produce these 4 energies. That is why when we use any kind of high concentrated medication, this energy will reduce even more and could cause blood stagnation. And this is why when we use also high concentrated vaccines, such as the COVID-19 vaccine, they could cause reduction even more of this energy in the root, leading to blood stagnation and leading to cases of thrombosis, myocardial infarction, and strokes. The second theory in the root is the 5 elements. As you can see, the 5 elements correspond to wood, fire, earth, metal, and water. And each element corresponds to one internal 5 massive organs, such as liver, heart, spleen, lungs, and kidney. As you can see, one organ is sending energy to the following organ, and one organ is sending energy to the other organ. One depends on the other. And as I told to you, the majority of patients nowadays do not have any energy to send to the following organ. That's why the theory that I created, titled Constitutional Homeopathy of the 5 Elements based on traditional Chinese medicine, is treating these deficiencies presented in the root when we use phosphorus to tone the liver, sulfur to tone the heart, use calcária carbônica to tone the spleen, and silicia to tone the lungs, and natrium muriaticum to tone the kidney. As I showed to you, any organ nowadays are not working. That's why we need to use these 5 homeopathy medication to increase the energy of our patients, to increase the immune system to fight against the COVID-19 infection and other chronic disease. In this article, I'm showing that after the COVID-19 pandemic, they implemented the globally vaccination. And in this article, as they are not studying the energy part, they understand that the majority of patients are immunocompetent. But in this article, I'm showing that the majority of patients that are receiving this kind of vaccines is considered immunocompromised and not immunocompetent due to this energy deficiency condition. In this article, is SARS-CoV-2 strong or our body is weak? I'm showing that it's not the disease is strong, but this is happening because our body is weak in the immune system, leading to this infection. Because in this figure, you can see that when our Xie Qi is normal, Xie Qi is the energy of the kidney to protect our organ from the invasion of these external pathogenic factors. When the Xie Qi is the Zhen Qi is our protection. Our protection when it's high and the factor is low, then the patient will not have disease. When the Zhen Qi of the patient, that's the energy of the kidney, is low, and the Xie Qi is high, that is the external pathogen, the patient will have the disease and will have the gravity of the disease. And when the Xie Qi and Zhen Qi and Xie Qi is almost the same, the patient will not have so grave symptoms. In this article, I'm showing that patients that are presenting anosmia and lack of taste when presenting SARS-CoV-2 infection, I'm showing that this symptom is not caused by the infection, it's not caused by the virus, because the lack of sense of smell and sense of taste is mainly due to the energy of the lung and the spleen. And when the patient has lack of energy in the spleen and lung, when they have infection, these deficiencies will happen more, and the patient will present this anosmia and lack of taste, and this is not caused by the virus. In this article, I'm showing that the patients that are having skin problems after having the COVID-19 infection, this is caused by the energy alterations that the patient have before this infection, not caused by the infection itself. And depending on the type of medication that we are using to treat this infection, such as the use of antibiotics, anti-inflammatory medication, anti-tamic, this high concentrated medication will reduce even more these energies and will cause formation of internal fire, leading to problems in the skin. And in this article, I'm showing that a patient that after this global pandemic, they implemented the global vaccination, and some side effects of this vaccination happens. And I wrote some articles showing that patients that had thyroid cancer before the vaccination could have metastasis after receiving the COVID-19 vaccination and causing fracture in the femur and caused by the metastasis induced by the injection of vaccines. In this article, I'm showing that to avoid intubation in patients with the respiratory failure due to SARS-CoV-2 infection, in this article, I'm showing that to avoid intubation, we need to treat this energy deficiencies condition because the respiratory failure is not caused by the virus itself, but by the energy deficiency in the lung, leading to difficulty in transmitting energy to the kidney, leading to the, leading to dyspnea symptoms. Sorry, let me take some more.
Please unmute, Dr. Huang. Please unmute. Yeah.
Can you hear me? When you treat this condition, replenishing the energy of these organs, the patient would improve the respiratory failure, and we will not need to intubate the patient. This I'm showing two cases of patients that needed intubation, but they treated using these 5 homeopathy to replenish the energy of these organs, showing that after this treatment, they do not need to use intubation. Sorry. And that's why I'm showing that the complications presented by the patients with COVID-19, the majority is caused by this lack of energy in these organs, in the root level of this tree. And depending on the type of medication that we are using to treat the COVID-19 infection, we will reduce even more the energy of these organs and will cause the complications such as respiratory failure or ground glass opacity or thrombosis or any kind of complication, fatigue. They are caused by this energy deficiency condition and worsening with the type of medication. That's why I wrote another article showing that homeopathy is the medication of choice to be used in the patients with SARS-CoV-2 infection because it will not harm the energy deficiency situation in these patients that that can have so many complications if we use high concentrated medications. I cannot move forward my slides. Can you see what's happening?
Yes, what do we need to do or need to avoid intubation patients? That is the slide. It is not moving now.
I cannot move my slides.
So maybe some technical problems there. I think you can restart the screen sharing. Yes, now it is moving. Now it is moving.
Okay.
Okay.
Okay, in this article that I wrote, I will show some articles that I wrote in this period to show this post-scenario, post-COVID-19 scenario, to show that we can have so many complications related to the treatment and to the type of vaccines they are using to prevent COVID-19. In this article, I'm showing that when elderly patients receive COVID-19, they can develop herpes zoster, but herpes zoster is caused by the energy alterations presented in the root of the tree of the patient that is having energy deficiency situation, leading to formation of internal fire inside the body, leading to herpes zoster condition. And that is why we needed to replenish the energy of these organs of these patients using homeopathy medications to increase the immune system of our patients and to treat the cause of this formation. In this article, I'm saying why anti-inflammatory medications are not recommended to treat headaches, manifestation of COVID-19. There are so many patients that are having headache after the COVID-19 infection, but I'm showing that the majority of patients are in this situation of energy deficiency, and I'm showing that the majority of patients with headache has the cause this energy deficiency condition in the 5 internal massive organs, and the use of anti-inflammatory medications can reduce even more these energies and leading to complications or even death of these patients. And in this article, I'm showing which could be the risk factors for developing cancer after receiving COVID-19 vaccines. After the implementation of global vaccination, they do not know that the majority of patients are considered immunocompromised, and this type of COVID-19 vaccine are reducing even more the energy of all these organs, leading to more propensity to have any kind of chronic disease, such as in this case, development of cancer. And in patients with cancer that are receiving the COVID-19 vaccine, they are having more propensity to have metastases after receiving this type of vaccine. And we can see that online there are recommendations of World Health Organization saying that they indicate the global vaccination in patients with cancer. But in this study, I'm showing that patients with cancer are having this energy deficiency condition, and when using this type of vaccination can reduce even more these energies, leading to more propensity to have metastases. In this article, I'm showing that patients that are presenting, that receive COVID-19 vaccine can present pyomyocytes after this injection caused by this energy alteration that cannot be improved by the use of antibiotics. because these pyomyocytes is caused by these energy alterations presented in the root. Patients after the COVID-19 treatment could have a pulmonary artery thrombosis because when the doctor use high concentrated medication to treat this infection, it will cause blood stagnation in any part of the body and can lead to pulmonary artery thrombosis. And that is why the medication of choice we need to treat the energy deficiency condition of our patients before this infection. And during the infection, use the homeopathy medication created by Samuel Hahnemann to treat this infection. But before and after this infection, it's very important to treat the cause of energy deficiency situation to increase the immune system of our patients before or after this infection to prevent the formation of any disease, including diabetes, hypertension, cancer, or myocardial infarction, etc. In this article, I'm showing that patients after COVID-19 treatment could also have myocardial infarction due to the type of medication they are receiving after this infection, using antibiotics, anti-inflammatory medication, reducing the energy of this patient that was already very low, leading to myocardial infarction. In this article, I'm showing that patient can have a severe urticaria reaction after receiving the COVID-19 vaccine. And this is caused by the energy alterations presented in the root, and that's why we need to treat this energy deficiency condition to treat the cause of this urticaria reaction, and not just treating the symptoms, because if we treat the symptom and not treat the cause, the patient will still have immunosuppression and will have more propensity to have any kind of disease. In this article, I'm showing why SARS-CoV-2 infection is just the tip of the iceberg. As I told to you in the slide of the tree metaphor, I'm saying that SARS-CoV-2 infection is only a leaf level of the tree, but the real cause of the immunosuppression is on the root of this patient, leading to propensity to have SARS-CoV-2 infection. In patients that are having ground glass opacity in SARS-CoV-2 infection, this is usually caused by the use of all these kind of high concentrated medications, such as anti-inflammatory medication, antibiotics, antithermic medication, leading to reduction in this internal energy and leading to stagnation of blood in the artery of the lung. And this is not a sign of infection. This is caused by the stagnation of blood in the pulmonary artery caused by the use of this high concentrated medication. And it's not caused by the virus, proved by some biopsies made by some studies after patients that were died from this infection, that were having this alteration in the tomography. They did the biopsy and showed that all this alteration was caused by blood stagnation and not by the virus itself. In this article, I'm showing that pulmonary manifestation in COVID-19 infection is not really caused by the virus itself, but could be by the energy alterations presented by the patients before the infection. Because the pulmonary manifestation of dyspnea during the infection could be the blockage of energy transmission from the lung to the kidney, leading to a blockage of this transmission. And when this is caused by the use of high concentrated medication, leading to reduced energy of the entire system. And when we treat this condition, rebalancing these energies using these 5 medications to treat this condition, it's very, the patient can improve their dyspnea symptoms without using antibiotics, anti-inflammatory medication that will worsen even more this energy deficiency condition. And the measurements to prevent COVID-19 infection in pregnant women is very important to us to know, because pregnant women also have this energy deficiency condition in the 5 internal massive organs. And we need to tone the energy of all these organs to increase the energy of our patients to prevent the COVID-19 infection or other complications. And to prevent stroke with or without COVID-19. Stroke is caused by the blood stagnation, also caused by the energy deficiency condition, because as I showed to you, the blood to circulate need yin and qi blood. And all these energy are very compromised nowadays in any persons, and could be worsening when we use any kind of high concentrated medication. In this article, are the vaccines the only solution to control the pandemic? In these articles, as I showed to you, I did a study showing that the energy of our patients before the pandemic were very compromised. And when we use this type of vaccine in this type of population, very weak in energy, this type of vaccines will not respond to prevent this infection, because the patient do not have energy to produce the antibodies to control this infection, because it's very weak in energy, it's very immunocompromised. And that's why in these articles, I'm showing that the vaccines are not the only solution to control this pandemic, because there are other measurements that we need to implement, increasing the energy of our patients to prevent this infection, instead of giving vaccines that are reducing even more the energy of our patients. In this article, why is high dilute oral vaccines for COVID-19 the safest option in this pandemic? I'm showing that the use of biotherapy using homeopathy medications, using SARS homeopathy made by SARS-CoV-2 infection secretion, is very good to prevent this infection. This is the safest option in this pandemic. And in Brazil, they do not allow us to use this homeopathy medication, because the vaccine is only the vaccine, injected vaccines is allowed, and they do not allow us to use this kind of homeopathy to prevent the COVID-19 infection. And this is what we need to change. We need to introduce this oral homeopathy vaccine to prevent this infection, to cure, to do not worse the energy deficiency condition of our patients that are very, very compromised, and also use these 5 homeopathy medications to prevent, to increase the energy of our patients. In this article, I'm showing that the mandatory implementation of passport for COVID-19 vaccine reduce or not the transmission. I'm showing that it's not reducing the transmission, because we are not still not treating the energy deficiency condition of our patients, and only using the vaccines will only reduce even more this energy and will increase the infection, and not only, and will not control. Patients that are having potential to transmit COVID-19 after receiving vaccination, There are some articles showing that patients that are receiving the vaccines have the potential to transmit the virus because they are still very weak in energy, leading to formation of this internal fire. And according to traditional Chinese medicine, when the patient are having the formation of this internal fire, this virus will adhere in the mucosa of the body and will transmit the virus due to these energy alterations. And that's why we need to treat the energy presented in the root to give less formation of internal fire and less potential to adhere the virus in the mucosa and to not transmit to others. And how can we prevent COVID-19 or other disease at the same time? As I showed to you in the metaphor of the tree, the root of the tree is the cause of formation of all disease in the leaf level. And when we treat this condition, treating the root of this tree, the root is considered the cause of all clinical manifestation. We can treat all kinds of disease at the same time using the 5 homeopathy medications. And in this article, why homeopathy is the medication of choice in the prevention and treatment of COVID-19 infection, I'm showing that the drug of choice is homeopathy because of this type of the energy alterations presented by the patients globally, caused by the modernization of telecommunication. And that's why we need to treat patients using homeopathy. And nowadays, treat the root also using these 5 homeopathy medication to increase the energy of these organs. We need to combine the use of the treatment of the root and also treating some symptoms of the patient presenting in the leaf level, but using homeopathy, because in my last publication, I showed that the use of any kind of high concentrated medication can induce myocardial infarction in patients, and that's why it's very risky to prescribe this kind of medication in this new type of population that we are having nowadays. Are the medication that we are prescribing harming them? I'm saying about the high concentrated anti-inflammatory medication, antibiotics, antithymic, antidepressant medication, all kinds of chemotherapy, all kinds of medication nowadays are harming the energy of our patients that are already very low, leading to many complications or leading to death of these patients. And what we need to learn from the COVID-19 pandemic, in this article, I'm showing that we need to understand that all alterations that's leading to COVID-19 infection are in the energy level that we are still not studying nowadays. We need to increase our knowledge and associate the knowledge of ancient medical traditions such as Ayurvedic and the Chinese medicine to understand the alterations in the energy level that are leading to all these diseases nowadays, not only COVID-19 infection, but these increased risks to have diabetes, hypertension, myocardial infarction, strokes, autoimmune disease, and in this case, cancer. Any kind of cancer have in the background this energy deficiency situation. And these are the 5 homeopathy medication. Instead of we memorize 2,000 medication to treat the leaf level, we need only to use these 5 homeopathy medication in the same bottle to treat all kinds of disease, including COVID-19 infection, and prevent the complications. And here I'm showing that we need one of these 5 homeopathy medication under the nozzle, SARS-CoV-2 nozzle. If we use these 6 homeopathy medications, we can increase our immune system, increase the battery of our organs, and prevent disinfection. Why we need to use homeopathy is because of Schultz's law that's saying that the use of any kind of high concentrated medication high diluted medication, can increase the internal energy of our patient, and this is what we want in our patients. And the use of any kind of high concentrated medication can reduce the energy of our patient, leading to toxic effect or lethal dose. The patient can die from this medication. The majority of patients that are dying from cancer, from COVID-19 infection, is caused by the type of medication that they are using to treat this kind of disease. And we needed to change the type of medication because the energy of our population changed in the past 10 years. According to Hippocrates, it's far more important to know which person has the disease than to know which disease the person has. We need to treat the patient and not the disease the patient has. We need to treat the root and not only the symptoms of the patients in the leaf level. And according to Albert Einstein, he is saying that everything is energy, and this is including the human body is also made by energy, and that's why before materializing disease in the leaf level, we know that there are energy operations that are happening years before the disease is diagnosed. And if we treat these energy alterations condition before the manifestation of disease, we will prevent the formation of any disease such as infection or non-infectious disease, including preventing cancer, because we are treating the cause of formation of any disease in the roots. I would like to thank all of you that are here in my presentation. If you have any questions, I'll be very happy to answer. Thank you.
Thank you, Dr. Huang Wei Ling. It's a wonderful presentation, and what is more interesting is that you have done a lot of works, scores of articles published in international journals. It's not an easy task. Then again, you studied all these things, different topics with different views. That's a really amazing job you have done. It's time for discussion. Those who would like to participate, please raise your hand and you can ask some questions to Dr. Huang, or you can have some additions. And well, the last question you raised is what do we need to learn from COVID-19 pandemic? Is the most important question, and I think we must learn that what is dominating in the world. No philosophy, no science, but economics. I think that is the most important thing that we realize or recognize after this COVID infections. Now, Mohammed Saidan, sir, are you ready? Yes, please unmute. You can unmute now, please. Yeah. Yes, welcome.
Audible, please.
Yes.
Thank you, ma'am. It's very interesting. I'm always following your publications. I'm not a doctor, but I'm interested in this type of science. I have brought from India the alternatives to maintain the energy levels in the body. And it is the
I cannot hear you. Your voice is not.
105 has diabetes mellitus. The type 2 diabetes mellitus. How can I apply? Do you have a protocol to apply these medications for such a patient?
Protocols for what? I cannot hear the.
For
What's he?
yes, yeah, I have a patient of diabetes mellitus type 2, and that's
Diabetes?
applies for, yeah, and that applies for the energy level to be treated. But I don't have the protocol to how to deal with such a patient. She's my wife. Could you help? Can I find a protocol how to deal
Yeah.
with such a patient?
Patients with diabetes type 1 and type 2 or gestational diabetes, they also have these energy alterations presented in the root that is the cause of diabetes formation.
Yes.
And when they treated the hyperglycemia only using the hypoglycemic medication and insulin, they will harm even more this energy deficiency presented in the root. And that's why patients do not cure their condition. And that's why they can also elevated hyperglycemia even using this medication. And that's why indeed I'm using the treatment of the root using these 5 homeopathy medication. We need to use I usually use Chinese medicine tools, changing some dietary aspects to balance that 5 internal mass organs, avoiding the ingestion of dairy products, raw food, cold water can cause hyperglycemia, and the sweets, and avoiding the ingestion of coffee, soda, matcha tea, and avoid the ingestion of fried foods, eggs, honey, coconut, alcoholic beverages, and melted cheese, because all these foods can increase the formation of that fire that are inducing the hyperglycemia.
Yes.
And that's why using all
Yes.
the changing the dietary aspects, I usually use acupuncture to regulate this internal energy. And using these 5 homeopathy medication, it is possible to reduce the hyperglycemia without needing to use insulin or hypoglycemic medications.
May I have the protocol? Where can I find the protocol to be applied?
They are all, I can send it to you if you want, because they are published. You can see, you can put on Google diabetes HUANG WEI LING PDF, and it will appear all the articles there.
I will write you on the Gmail.
My email?
Yeah,
Okay.
I've got your email at Gmail. Is it?
I can send it to you. I will put my email address, and you can send your email to me, and I send to you. Okay?
Exactly. Thank you. Thank you,
You're
ma'am.
welcome. Bye-bye.
Thank you, Dr. Manoj.
You're welcome.
Yes, the Gmail, the mail ID is in the chat box. You can note that.
Thank you.
Well, the question was to explain or give some clue regarding the protocols of the treatment of type diabetes, how the energy levels can be changed. Now, Sridhar sir, please unmute, sir.
Yes, Dr. HUANG Wei Ling. Madam, it is a very excellent session, very good. But what was your question? I was not listened properly. I couldn't understand your last question.
You cannot understand.
Yes, Dr. Manoj, will you please tell what about the question she asked?
Who asked this?
Yeah.
It is asked by Mahmoud Saidan, sir.
Yes.
Yes. How?
No, that I understood. That she asked some question about COVID.
No, exactly. Not exactly. Would I repeat my question, please?
No, sir. It is not about your question, but Dr. Huang, did you have any questions?
She was asking last that after COVID.
Yes. What to do? Yes, sir. What to do? What do we need to learn from COVID-19 pandemic? That's the question.
What we
need to learn from COVID-19.
Yes,
pandemic.
There are so many other so-called X or Y or Z diseases can come. but we must be very prepared and we must be very competent to treat that. That is the lesson. One thing that we must not fear. Of course, it can happen anything. Again, we must not fear, and unnecessary, we must not use the not properly experimented vaccines, we must not use. And that must be the caution. And it is one way. It is good for the people like that of me, that because of that we are started this Zoom session. So many good things are happened. But one part is that there is so many people died and suffered so many, but there are good things in the bad also, that we must have to take that. So we must have to ready for to face such infectious new diseases. It may be X or Y or Z, PQRS, whatever it may be. The name may be different, but we are on symptomatic and constitutional level we are treating, so that there will be a definite answer in homeopathic medicine. There are since 1796 onwards, there are so many medicines. So it is useful. It is not going to change. It is not changed. It is still using. It will use also. There is no need of fear. That is the answer for that, what I feel. Whether it is any different opinion, you can say something. What is my opinion about your question?
Yes,
Okay,
Dr.
thank
Huang.
you.
Yes,
And
Dr. Huang. Yes, what is your reply? You just raise a question. What do we need to learn from COVID-19? That was your last question, and Sridhar sir replied that we can face all these problems with the law of similars of homeopathic medicines. We don't need to develop any new disease because we are depending the similars, not the same. That's the important thing. Mahmoud says, sir, what is your doubt? Yes, sir, please.
Yes, I have another question, please. Can I?
Yes, of course.
Okay.
Yes, thank you. Ma'am, what is your opinion about treating pulmonary COVID by oxidative agents such as hydrogen peroxide and ozone? Do they apply? Would the patient be benefited by? Did you have any experience of that?
I don't have that much. I treated about to be more than about 1,500 patients during
Excuse
the
me,
time of.
Sir, the question is to Dr. Huang Wei. Sir, please wait.
Oh, no, okay.
Yes, sir. Dr. Huang.
Hi. Sorry, I didn't hear because the sound was not good. What kind of disease do you want me to explain?
Yeah,
The
the
pulmonary
question
person.
is, do you have an experience in treating COVID patient with oxidative agents such as hydrogen peroxide or ozone? Do they apply? Would the patient be benefited by? Do you have any experience of that?
No, but what we need to learn is that all patients with COVID-19 infections are very weak in energy. If you give any high concentrated medication, he will worse. And that's why we do not use any kind of oxidative medication that is high concentrated. He will worse his condition. And that's why only homeopathy medications, and if possible, treat the root together, because the dyspnea symptom that is very common in this patient is caused by the energy deficiency condition. And that's why you need to give homeopathy to treat the root to improve the dyspnea condition of the patient. Okay?
Clear, sir? Mahmoud Saidan, sir, clear. You got the answer.
Thank you. Yes.
Definitely in the coming years, when the chatbots or artificial intelligence technologies improve, definitely the communication will be more easier. Otherwise, the accent is very difficult to grasp. Both Dr. Huang Wei, your accent is very difficult for us to follow. As also, Mr. Mohammed Saidar, sir, your accent is also very tough. But fortunately, in Malayalam, we have the 51 letters. So we are rich vocabulary. We can follow each of your language. That's the most important thing. Yes, I think.
Madam, what about the answer of my answer? What you feel?
Dr. Huang, what is your answer to Sridhar sir reply? Dr. Huang,
Hi, I'm here.
what is your reply to that Sridhar sir told?
What you want me to answer?
Yes, what is your yes? Sridhar sir replied.
Where's answer what question? I didn't hear the question.
Sir, could you please repeat, sir? Only 3 minutes remaining.
Yes, whether it is time is there or not, I don't know. Anyway, I shall repeat. We don't want to worry or fear about the COVID or any such X or Y or Z or any P, Q, R, S, T or anything. We have sufficient remedies in our materia medica, but the case taking must be proper, and in an Humanian way we must have to take the case and properly we study in constitutional way, and venus epidemicus we must have to find out. We don't want to fear any disease. The fear is the number one in the world. The first one is to the disease, second one is the death. That fear can cause to the immunity level, can cause to down, immunity will reduce. So the disease can occur. So that in what I feel is, it is a good occasion. We must have to take the good side of also. If that might not happen, the COVID might not, we will not learn the lesson from the bad also. A stepping stone for our life. We know what to do and how to overcome. So without testing the vaccines, we must not accept the vaccination. Now, people are not accepting, and the government is also little bit changed. Why? Because of that they realized it is not tested properly and they are afraid, and it is not at all, it was not able to prevent. So it is, they agreed. So it is the lesson we learned from the COVID. So I feel it is the biggest pandemic in this last century.
Okay,
this
sir.
last century, this is the lesson we learned. So we must be prepared. Every homeopathy doctor must be prepared and to be competent for to such an event. That is all. Thank you very much.
Okay, time to wind up the session. May I invite Ram Parvez sir to express word of thanks.
What I want to emphasize,
Yes.
what I want to emphasize in COVID-19 treatment is that in acute phase, when the patient is having fever, you do not use the treatment in the root. You treat the leaf level, use the homeopathy medication that you are using to treat this condition.
Excuse me, Dr.
Only
Excuse
in the when the patient is better, we can introduce.
Our time is up. We have to go to the next session now. May I invite Dr.
Thank you.
Yes, sir, please.
Thank you, Dr. HUANG WEI LING.
Okay,
Very
you're
nice,
welcome.
Very nice presentation. Excellent session. Congratulations.
Thank you very much.
For potential in treatment homeopathy. Very, very thanks. Behalf of IFPH. Very, very thanks. Again, platform.
Okay.
Thank
so we
you.
have to adopt different modalities according to people and situations. The remarks we conclude today's English edition. Hope you that we'll be back again tomorrow. Goodbye, and Dr. Shaila to continue the program in Malayalam. Thank you.